I'm Dr. Kaylee with Salt and Light Waco, and as a pediatric chiropractor, I understand the difficulty journey of navigating the overwhelmingness of oral ties. With so many providers having differing opinions, it can really feel challenging to know what's best for your baby who is struggling with breastfeeding or showing discomfort, reflux, or tension. Today, I'm here to help you understand your options and make confident decisions for your baby's care. In the next 15-20 minutes or so, I'll break down what oral ties are externally and on a deeper level, explain how they can affect your baby's overall development, and then walk you through our gentle, natural approach to care to help support your baby's feeding journey as well as their foundational development. And here's why addressing these ties matters so much. Whether you're considering a revision or exploring other options, understanding how they can affect your baby's overall development helps you make more informed decisions for their care now and later on. Let's dive in together, get you the clarity you need, the clarity you're looking for, and help you make confident decisions for your baby. Oral ties or tethered oral tissue come in three main categories: tongue ties, lip ties, and cheek or buccal ties. The cause of oral ties comes from two different avenues mostly. The first type is genetic, and so it's often referred to as ankyloglossia, which is a shortening of that frenulum under the tongue. And the second is a neurobiomechanical reason, which is due to cranial, spinal, or neurological imbalance that's causing that muscular dysregulation and tension in the baby's oral system. You can think of ties of like tiny rubber bands that restrict the way the mouth moves in three different areas. While the tissue themselves is completely normal, sometimes they can be too tight or too thick, restricting function. When this happens, it can affect how your little one feeds, breathes, and even develops. As a pediatric chiropractor, I look at oral ties through two important lenses. The first, how they impact your baby's daily functions, and also what they tell us about the underlying tension patterns that affect the rest of your baby's body, not just their mouth. In our world of what we see, oral ties are often just the tip of the iceberg. What we see in the mouth is often reflecting a deeper pattern of tension along your baby's midline, all the way from their head to their tailbone, even to their toes. You can think of it like a pull in a piece of fabric or your favorite shirt. Where you see the pull affects it down the line and all the way down the shirt. We'll dive deeper into this connection, but when we talk about development, it's really important to understand that oral ties aren't only isolated to the mouth. Each baby's oral ties are different, so each baby's care must be different and unique to them. What matters most isn't either if there's a tie or not, it's knowing how that tie is affecting their functions, again, in their mouth and the rest of their body. Some babies may have what looks like a significant tie, but manage just fine. And some babies may not even have a visible tie, but they're really, really struggling with function and having some bigger challenges there. As we go through this together, I want you to start to think about your baby's daily experiences. Are they struggling to latch efficiently and effectively? Do they seem uncomfortable before or after feedings? Are they having trouble sleeping, dealing with fussiness, gassiness, or overall digestion troubles? Those are the functional signs we look for, especially as they relate to ties, because they tell us more than what we just see in the mouth. First, we'll jump into one of the most intimate and often challenging parts of early motherhood, which is breastfeeding. As moms, we often picture these beautiful moments where baby's perfectly still and nursing and we're in our rocking chair, but when challenges arise, it can feel really overwhelming, isolating, or even bring up feelings of guilt or unworthiness, which are just so not true. And so you're not alone, and we're here to help and walk you through these things. Latching issues, whether it's on breast or the bottle, are often the first things mom notice when they think there might be a tie issue. Your baby's tongue should act like a wave on either your nipple or the bottle nipple. When there's a tongue tie, that natural wave motion is restricted, and instead of your baby's tongue curling up and creating really good suction on the nipple, what happens is it stays lower in the mouth and compressed back, kind of like you're trying to drink from a straw that's really, really flattened. This can lead to what many moms experience with a difficult breastfeeding journey. It can be painful nipples from the baby chomping. It can be milk dribbling out of the corners of their mouth, them not having efficient feeds, it taking a really long time to feed, or even having to constantly flip their lip out during the feed on the bottle or nipple. Some moms even tell us that oftentimes their babies are exhausted during feeds, falling asleep before they finish, while others notice they get really riled up and become really colicky and fussy during or after the feed. All of these challenges connect to your baby's oral anatomy as well as their entire nervous system development. When your baby's tongue can't reach the roof of their mouth or cover the bottom of their gums while latching, it affects everything from how much suction's created while feeding, the overall efficiency of them eating, and even it can affect how their palate and airway develops. You can think of these ties kind of like a kink in a water hose. If you kink it close to where you turn it on, the water flow is affected from that kink on. It's the same thing with the tie. That initial restriction can have a ripple effect throughout the body. When it comes to addressing ties early, I want to hit on why that's so important. So, even aside from if there's no latching difficulties or others, it's really good to look at them from a stance of how it may impact their long term development. And so, again, we often focus on the immediate need, whether it's latching or reflex challenges, but also understanding the potential long-term effects can help you make a really informed decision for your child too. Speech development is one of the most significant areas that later on can be impacted by those oral ties. And so think about how your tongue moves during speech. Even as I'm speaking now, it needs to reach different spots in your mouth, behind your teeth, by your gums, to make the various sounds and noises and pronunciation. When a child has a really restricted tongue, they might struggle to develop clear speech and pronunciation because they can't move their tongue in proper ways. This isn't just about the physical ability to make the sounds, it's also about developing a good awareness of the tongue's geography or location in their mouth, which is really crucial for proper speech development. In the same avenue, sleep quality is something that is really big and can be affected by oral ties. When the tongue doesn't rest on the roof of the mouth properly, it affects your child's breathing patterns, which really can impact sleep as well as the development of their nasal passage and airways. Oftentimes, we look for kids that are, we say, mouth breathers or their jaw is just dropped open all the time. And those kids often have poor sleep and also have a ton of congestion. And part of the reason why they have those things is because when we're breathing through our mouth at night, we're not getting as much efficient oxygen to our brain as we're sleeping, as well as we don't have all of the barriers that our body has built in to filter through dust, bacteria, viruses, all those things. So they're going directly into our throat and lungs, as opposed to the filtration system that our body has when we breathe through our nose. When it comes to having poor sleep due to oral ties too, that can cascade into other challenges. In fact, there's a lot of traditional healthcare providers that are finally starting to notice this, and they're recognizing that sleep challenges are associated with airway and mouth breathing. So they're jumping to that first as opposed to immediately diagnosing ADHD or looking at a medication or anything like that, because they realize there's a deeper root cause to it. The tongue also plays a really crucial role in cleaning your teeth and helping with oral hygiene. And so as well as shaping your oral cavity and working with your palate, it also works in cavity prevention with that too. When it can't move properly, some things we might notice are food particles are staying longer in the mouth, which increases cavity risk. There's difficulty swallowing, maybe an overactive gag reflex. There's that chronic mouth breathing that we mentioned, which can lead to more frequent allergies and congestion. There can even be changes in facial development and structure due to that improper tongue positioning, again affecting the airways. And the most surprising thing, often to parents, is how those little oral ties can affect overall development, even as it relates to motor milestones for babies. Remember that central line that we talked about running through your baby's body? Any restricted oral tissue can create tension patterns that affect everything from how your baby crawls, how they roll over, how they're able to do tummy time, and how they're even able to coordinate movements as it comes to pulling up, standing, running, walking, jumping, all of those things. If you're a little later on in development and thinking there may be a tie issue, some things you might notice are difficulty rolling over or crawling in typical patterns, back arching or body stiffness, preference for turning their head to one side, or challenges with coordinating other movements, such as going from seated to laying down or vice versa. This is a huge reason alone of why body work, especially pediatric chiropractic, can be really helpful and beneficial early on. By addressing these movement patterns early and tension patterns early, we can support your child's natural development path and potentially prevent these long-term effects from those restrictive ties throughout their body. The goal isn't only to just address the immediate concern with feeding or reflex, but it's also to set your child up well for development in all these other areas that we've talked about. Now, I want to jump into how your baby's nervous system connects to oral ties in those feeding challenges. It really is so cool how all of these pieces work together and how the Lord made our bodies so incredible. From birth, your baby comes fully equipped with all the abilities to latch, have all the reflexes, especially the suck, swallow, breathe reflex that helps so much with feeding and nursing. This isn't something that has to be learned. It's an innate property that they have within them, which essentially means they're just born with it. When we look at feeding challenges, we don't only want to look at just the mouth, we want to look at the structures from the nervous system that control the mouth as well. There's a complex network of nerves, including 5 crucial ones that work alongside 26 different muscles to coordinate every aspect of feeding. These nerves kind of act like puppet strings to tell the lips when to seal, the tongue when to move, the throat when to swallow. Every function as it relates to feeding is controlled by those nerves and muscles. And again, these nerves are working and they all come out at the base of their skull and the baby's upper neck, which are constantly communicating between the mouth, the throat, the rest of the body, and the brain to tell it what to do. I want to run through the 5 key nerves, what they are, and what they're in charge of. The first is the glossopharyngeal nerve, and that controls the swallowing muscles, which ensures milk goes down safely. The second is the vagus nerve, and this is like your baby's superhighway nerve. This connects their brain to their digestive system, immune system, and helps manage everything from tongue movement to sphincter control to upper and lower digestive signals and beyond. The third is a hypoglossal nerve, and this one is the main conductor for tongue motion. So all of those tongue motions to eat is what this one's in charge of. The fourth is the facial nerve, and this controls all the muscles of the face and lips that control the seal, suck, and all of that. And then the fifth is the spinal accessory nerve, which controls the baby's head control and movement as it relates to feeding and how they need to position themselves. Here's why all of that matters. Sometimes what appears to be a tongue tie or tongue issue may actually be related to the function of those nerves and their ability to send signals clearly to the mouth and jaw and all the muscles to do their jobs. The nerves controlling the tongue may be overactive or underactive, which makes the tongue appear really restrictive and not functioning properly. There also might be misalignments in the baby's cranium or upper neck that's affecting how those nerves work, which is where chiropractic specialty really comes in. That's what we call that biomechanical, neurobiomechanical tongue tie. And again, this is where pediatric chiropractic becomes really crucial for these kids. Before considering revision, it's really important to assess whether that restriction is truly from the tissue or if it's more so related to nerve function throughout the body and due to the tension and alignment. Oftentimes they can come together as well. Through gentle adjustments, what we do is we address that nerve interference that's affecting the tongue motion, jaw motion, suck, swallow, breathe reflex. We align the bones and joints that connect all those feeding muscles and movements, and then we release tension patterns in their cranial bones and neck, as well as throughout the rest of their body that support, and all of that supports optimal nerve communication from their brain to their body and then back. From there, if a revision is needed, because often, like I said, it may be both of those things, chiropractic care becomes even more valuable. That pre-revision care helps optimize healing conditions, decreases overall tension, and ensures proper alignment before the procedure. And then the post-revision care supports proper healing and development of the new movement patterns and makes sure that tension doesn't settle back into how the body was used to functioning. It helps it create a new, more functional pattern. The goal is really to support your baby's natural development by ensuring all these systems are working together effortlessly. When we address those underlying tension patterns, we often see improvements not just in feeding, but in overall development, including digestion, reflux, gassiness, and even down the line, future speech development, airway, and even that emotional regulation and focus. As we wrap this up about our discussion about oral ties, the biggest goal of this is for you to leave empowered, having more knowledge and having more options of what you can do for your baby's oral tie. And so we've covered a lot, from how oral ties affect feeding and development to the intricate connections of your baby's nervous system and overall function, especially as it relates to feeding. The biggest thing I want you to remember is oral ties aren't only what we see in the mouth. They're a part of a larger picture involving your baby's entire body, from those crucial nerve pathways that control feeding and the fascial connections that run from their head to their toes and everything in between. Whether you're noticing feeding challenges, weird developmental patterns, or just considering revision, wanting to know your options, understanding all these connections helps you make more informed decisions for your little one. One of the biggest things too is having the right team of providers. That's going to be extremely beneficial to get your little one the help you need and help them have the best outcome. And along with a trained pediatric chiropractor, we always recommend working with a trained and skilled IBCLC lactation consultant, as well as a dentist that's trained in adjusting oral ties and airway development. That is the way you'll have the most comprehensive team for your child. At our office, we understand how overwhelming it can be navigating this world of oral ties. There are often a ton of different opinions from various providers, and it's super natural to feel uncertain and like you have no idea what to do in your path moving forward. That's why I want to encourage you to think about your baby's unique situation, their unique systems. Consider the immediate impact that it will have, as well as the long-term developmental impacts that it could have. And if you take away 3 key points from today, I hope they are: number 1, your baby's body is an interconnected system from the tongue to the arms to tailbone to toes. What affects one area of the body will affect everywhere else as well. Number 2, early support through appropriate care can make a significant difference in your baby's developmental journey, which is why having great providers on your team is key. And number 3, whether you choose to revise or not, supporting your baby's natural function and development through pediatric chiropractic care really helps optimize their development and make sure the underlying tension, not just in their mouth, is addressed. If you've noticed any of these things in your kiddo, whether they're a couple weeks old or a couple years old and wanting just an opinion and some help, we're always here and happy to help and love guiding parents through, helping them make informed decisions and increasing education, because we really believe knowledge is power, and each individual kid and child has individual needs and needs individualized care. And so if you have specific questions about your baby or kiddo situation, I encourage you to reach out to our office. And together we can help make a plan for your kiddo's unique needs and help them thrive and grow really well.